Hello, everyone. It's February the 10th, Wednesday. Before I go any further, I want to say this, that today our legislature comes back and they'll be calling themselves back into session and doing great work in the days to come, and that's to be at 12 o'clock. So, you know, in trying to be appropriate and everything with the media, we're going to try to end this, you know, a couple of minutes before 12 and everything, and but nevertheless, so we're going to hustle through today. We have had 44 deaths since Monday. I'll read those to you now. We're now up to 2,175 deaths in West Virginia, and all I would say is just this, and I'll say it very quickly, but when you think 44 people have died since Monday, and you know, it seems like we're almost getting numb to these numbers, but I keep going back to just this, the Sago mine disaster, you know, where there were, I think, 12 miners that were trapped, and 11 of them perished, and then one was, you know, had a lot of bad problems and everything, you know, but in all the tension and all the prayers and all the concern, well, we've lost 4 times the Sago mine since Monday. So please, please know that you got people out there that are really hurting and they really deserve and need your prayers. Our 2,132nd death is a 63-year-old female from Marion County. Our 2,133rd death, an 82-year-old female from Marion County. Our 2,134th death, a 65-year-old female from Jackson County. Our 2,135th death, a 64-year-old male from Doddridge County. Our 2,136th death, a 68-year-old female from Wood County. Our 2,137th death, a 69-year-old male from Cabell County. Our 2,138th death, an 82-year-old female from Logan County. Our 2,139th death, an 81-year-old female from Barber County. Our 2,140th death, a 77-year-old male from Cabell County. Our 2,141st death, a 66-year-old female from Logan County. Our 2,142nd death, a 90-year-old female from Mercer County. Our 2,143rd death, a 79-year-old male from Mercer County. Our 2,144th death, an 85-year-old female from Kanawha County. Our 2,145th death, an 83-year-old female from Barber County. Our 2,146th death, a 73-year-old male from Mercer County. Our 2,147th death, a 64-year-old male from Raleigh County. Our 2,148th death, a 64-year-old female from Mercer County. Our 2,149th death, a 96-year-old female from Raleigh County. Our 2,150th death is a 91-year-old male from Pendleton County. Our 2,151st death is a 70-year-old male from Upshur County. Our 2,152nd death is a 71-year-old male from Harrison County. Our 2,153rd death is a beautiful lady, a female, 101 years old from Mingo County. Our 2,154th death, now get this, a 25-year-old male from Jefferson County. Our 2,155th death, a 35-year-old male from Wood County. We've told you over and over, naturally the target is the elderly, but without question, this thing is across the spectrum. Our 2,156th death is an 87-year-old male from Monongahela County. Our 2,157th death is a 41-year-old female from Cabell County. Our 2,158th death is a 91-year-old male from Wayne County. Our 2,159th death is a 68-year-old male from Monongahela County. Our 2,160th death is a 66-year-old female from Monongahela County. Our 2,161st death is a 99-year-old male from Putnam County. Our 2,162nd death is a 62-year-old male from Mineral County. Our 2,163rd death is a 63-year-old male from Logan County. Our 2,164th death is an 83-year-old male from Wayne County. Our 2,165th death is an 89-year-old female from Jackson County. Our 2,166th death is a 74-year-old female from Monongalia County. Our 2,167th death is a 61-year-old female from Harrison County. Our 2,168th death is a 61-year-old male from Mercer County. Our 2,169th death is a 56-year-old female. Our 2,169th death is a 56-year-old male from Morgan County. Our 2,170th death is a 90-year-old male from Jackson County. Our 2,171st death is a 79-year-old male from Cabell County. Our 2,172nd death is a 67-year-old female from McDowell County. Our 2,173rd death is a 64-year-old female from Wyoming County. Our 2,174th death is an 80-year-old male from Mason County. And our 2,175th death in West Virginia is an 86-year-old female from Upshur County. Ooh-wee. I'm really sorry. I am really, really sorry. It is such a shame. There's only one way to go, though, and that's keep going north. Please keep them in your prayers. Please, please do. Our numbers are better, but we're still losing great West Virginians. Great, great West Virginians. We have 429 new cases in West Virginia in the last 24 hours, and that's really a lot better. Our daily percent positivity rate is at 4.26, and that's a little better. Our cumulative positive is at 5.60. That's about where it's been, maybe a little teeny bit better. Our active cases are 14,076, and this is the 25th straight day that they've gone down. And that's wonderful. Recovered cases are 109,700, and if you'll look at the graph, it just keeps getting wider and wider. We want the dark blue to go down, light blue go up. That's what's happening. We have 362 people that are hospitalized in West Virginia right now. That's significantly better. This is the first day that we have had under 100 patients in the ICU units in West Virginia since November the 11th. Since November the 11th, we have not had less than 100 in the ICU. We have 97 today. You know, our daily county alert system map has 3 counties in the red, and that's really good as well. We want to get rid of all that red on that map. We're really close. We're really close. We're picking up a bunch of green now and really, really, really close. So, you know, those border counties up in the Eastern Panhandle, I know, are influenced a lot by what's going on in Virginia, but you got to be careful, and we got to get you out of that red. I remind all the people 65 and older, if you have a sniffle, I've said many times, headache, you're tired, go get tested. We can give you the antibodies and save your life. Last week in West Virginia, we had an administration rate of first-round doses of 107.8%. It is amazing beyond belief. We got more shots out of the vial than 100% of what we were allocated. And we, last week, administered on our second doses 91.2%. And today is the first day that we've achieved over 90% on second round doses. This is really, really incredible. That's all there is to it. You know, you owe so much to all the people that have put in the licks out there, and they've done phenomenal, tireless work. You know, our goal is to always get 100% of the shots in people's arms, and, you know, and all across our clinics, you know, are saving our wisdom. And if you don't understand the saving our wisdom part, just think about it. We've lost a ton of our elderly. That is our wisdom. And we've got to continue to do everything we possibly can do. We have now total doses in somebody's arm, first and second round shots of 335,307 in West Virginia. And we just continue to thank all the counties, all the community partners, all those from the health to the DHHR to the Great National Guard and all the people that have done so many licks. We thank you in every way, the experts, and, just amazing what has happened here. As of this morning, West Virginia continues to lead the nation in our vaccine administration. We have now used 101.67% of all allocated doses of vaccines from the federal government. Today is the first day that we've achieved over 100% usage of both doses. This is a huge achievement, and I am certain that no other state can possibly be ahead of us. A total of 6.2% of our entire population has been fully vaccinated with both doses. We're leading the nation in all these metrics. Just keep it up, right? West Virginia, you're doing absolutely great, and we're going to beat this thing. We're going to show the world how to beat it, and then they can run the West Virginia play. Running the West Virginia play last night, West Virginia University had a giant win and everything, and then they must have run a lot of good West Virginia plays last night as well. I tell you over and over about wearing your mask and giving blood and everything, and if you've had the blessing from God above to recover from this dreaded disease and everything, go give blood. Really and truly. If you can give back, in my opinion, you owe to give back. Go give blood. We need you to. Our long-term care facilities now are down to 42 outbreaks, and get this. How many times have we had dreaded problems with our churches? Today, we have one outbreak reported in one county in regard to our church community. Fayette County is the only county right now with an outbreak. Man, you talk about great work. That is great work by our church community and everything. Keep it up. I could never be any more proud and everything. It is really wonderful, wonderful work. We have 52 inmate cases, and there were 50 on Monday. We have staff cases of 15. There were 22. The inmate cases, include 29 at Southern Regional and 16 at North Central. That's great work there as well. I tell you about getting tested and all the free testing places, and the testing map is all up there. You can see that on our website. I thank the drive-through pharmacy people, at Fruth and Walgreens, over and over for the great work that they've done. The COVID-19 vaccine info line is up. You see all that. I remind people to take your vaccine, for crying out loud. It is the craziest thing in the world to not take this vaccine. I can't guarantee any and everything in the world, but at the same time, the results of this vaccine are amazing as far as the goodness. The downside is almost nothing, and the upside is unbelievable. And the other side of the equation is, well, let's just don't take the vaccine. And you see what the downside is. I don't want to read your name. Please take the vaccines. Here's a warning of something. The West Virginia Fusion Center recently discovered that an unauthorized sale of COVID-19 vaccines are happening on various websites. We do not attempt to purchase, and you should not attempt, please do not attempt to purchase a vaccine online. Vaccines are not authorized for sale through any marketplace and should be reported to the COVID hotline or to law enforcement. Not only that, you could absolutely get, who knows what could happen. Who in the world knows? What in the world could happen, by you going in and trying to buy a vaccine that is not authorized in any way. Who knows what it could be? It could be a vial full of water. It could be a vial full of something else, you know, that you really, really could get in trouble with. It just absolutely would be a terrible bad move. I tell you again about the antibodies. You know, we got them in the state. If you can get tested and you're positive, we'll stop this thing in its tracks. But we got to get on it early. Yesterday, we were told that the Biden administration committed to even more vaccines to our state. It's looking like soon West Virginia will be getting more vaccines from the federal government, and we continue to bombard them with requests and everything, and continue to bombard them with how we've administered and how good we're doing in West Virginia. On Monday, I told you that we joined the federal pharmacy program and partnered with Walgreens to get extra doses for Operation Save Our Wisdom. Since Monday, the allocation has increased from, I think, 5,600 or 5,800 to 7,300 to our Walgreens locations, with 100 doses going to 53 different locations all across our states. All appointments are going through our registration system. So again, I want to thank Walgreens and encourage everyone to pre-register. Okay, this week, you know, we held all of our clinics in all 55 counties. We're going to continue to do so on Save Our Wisdom. Be sure that you check for updates due to weather. You know, names are pulled from the West Virginia vaccine registration system to fill out appointments and wait lists. If you're on that and everything on a wait list somewhere, this will not affect that in any way. Absolutely register. You've got to register. You can go, any resident can go anywhere in any county. You know, I want to again to encourage everyone that's above the age of 65 to go online and get registered. We do not have enough vaccines to go around, but we are trying with all in us to get more and more vaccines every day, and we will call you in as to the vaccines that are available. So far in West Virginia, and this is the number that I am absolutely so proud of, it's off the chart, but so far in West Virginia, we have put shots in arms of people that are 65 and older, 115,327 individuals in West Virginia that have chosen to be vaccinated, and 46,184 of them have been fully vaccinated. You know, as far as our vaccine scheduling system, all West Virginians above 16 can register. I've told you over and over to go online and just go pre-register. It takes about 10 minutes to do so. We've done that now with in a little over 2 weeks with 229,000 West Virginians, and you can pre-register online. But if you still have trouble and everything and you can't do it and you're struggling with it, call us and we'll get it worked out for you. That's all I've got right now. We're going to try to hustle along today, like I said, with the legislature coming in, and so that's all I've got for right now.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. As Governor Justice pointed out, we continue to make significant progress with the rollout of our vaccine distribution. We will see probably some weather-related issues later this week, so we ask all West Virginians to pay attention to the weather as well as announcements that are made related to vaccine clinics. We want people to get vaccinated, but we want to do it in a safe manner. We will ensure that we make the appropriate coordination to deal with weather challenges, but please pay attention to that. We also ask you to pay attention to second doses. For those who are coming up on second doses, you should receive your second dose at the same clinic location that you received your first dose, with maybe a few exceptions. So please pay attention to that. As Governor pointed out, we continue to improve and roll out more components of our registration system. We will be adding, between DHHR and the National Guard, up to 50 additional personnel who will be helping with the registration as well as the appointment scheduling components of our system. So as the Governor pointed out, an additional 7,300 doses now from Walgreens. We also see on the horizon doses under the federal pharmacy program going to our federally qualified health clinics who are already integrated into our joint interagency task force. So that will make it a smooth effort to move forward with that. We appreciate the great work of all the staff that are working on these things. Just want to again reinforce the governor tasked us to focus on targeted populations based on the data that we have. And what we are now seeing is a reduction in hospitalization rates, a reduction in death rates, a reduction in things to look at based on past events. So I want to just add 2 more data points related to that. In June of 2016, a 1,000-year flood event, we lost 23 great West Virginians. If at that time we would have told all West Virginians that we needed you to prepare sandbags because we had another wave coming and we would have 100 times more deaths than those 23 great West Virginians, every West Virginian would have stepped up and started putting sandbags together. Well, we're coming up close to 100 times the number of people that we've lost in the 2016 flood. And what we are asking you to do is not prepare a sandbag. We're asking you to wear a mask and pre-register so when vaccines come available, we can efficiently and effectively and quickly get you a vaccine, because we know the data out there shows that we are making progress. We also know internationally that data is revealing and showing the same things. The country of Israel has the highest rate per 100, 54.7 people per 100, and their numbers are significantly improved. Next behind them is the United Arab Emirates at about 38.7 per 100. The next country is the United Kingdom at 14.7. In between that is the state of West Virginia at 18.7 per 100. West Virginians, do what the governor asked, wear a mask, go in and pre-register, and we will keep pressing the federal government, get us more vaccines, and we will get this thing on the right track. Thank you.
All right, thank you, sir. Dr. Clay Marsh, Dr. Ayn Amjad, and Secretary Bill Crouch are all available for questions today. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thank you very much for taking the question. Congratulations, Governor and General Hoyer, on the great vaccination numbers. Well done in getting those shots out. I do have 2 quick questions for both of you men. Governor, you cited at the end of your briefing on Monday the statistics which help bolster the argument to add 50-plus teachers to the vaccination system. I say 97% of all West Virginia deaths have been from residents 50 and older. I was wondering, due to those numbers and the great danger it presents to that age group, when will you be adding non-teaching and school service personnel, West Virginians who are 50 and older, to be eligible to get a shot? And General Hoyer, in talking to Governor Beshear in Kentucky earlier this week, they mentioned that they also opted into the federal pharmacy program with Walgreens, but they insisted that local independent pharmacies to be added to their mix. And that happened. So they're using a hybrid of both Walgreens and local independent pharmacies, which West Virginia used to such great success to get nursing homes and other people vaccinated earlier. So is there a chance that you can negotiate with the federal government, if you so desire, to add independent pharmacies to the Walgreens system that is now set up, just like Kentucky was able to accomplish? Thank you very much.
Okay, Kenny, I'm going to pass to General Hoyer and to Dr. Marsh, but Kenny, if I heard correctly and everything, and maybe you guys can have this better than I, but I'm under the opinion that if you said service personnel that are working at schools, that have not received their shots, or what, that were 50, age 50 and greater and everything, I'm of the opinion wholeheartedly that we're vaccinating those people, or we've offered to vaccinate those people. But General Hoyer and Dr. Marsh, y'all can jump in there, please.
Yes, Governor. Kenny, Governor has already directed us, and we should start as early as next week, essential workers over the age of 50 in other sectors. We had planned on doing it a little bit earlier. However, until the dose rates increased, we were unable to get to that point, but it is in a part of our plan, a part of our rollout for essential workers over the age of 50. Related to the federal pharmacy program, we're not negotiating. It's already in progress. Walgreens is just the first of West Virginia's to roll out. We also are rolling out over the next couple of weeks access to others, those currently listed in the federal pharmacy program nationally are Walgreens, Kroger's, Walmart, CVS, and independent pharmacies. And just like we did with the rollout for the nursing home and assisted living facilities, our objective is to expand this out across the state of West Virginia, but most importantly, use our central registration system to make sure we effectively and efficiently get the people that we need to the doses.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I was wondering, because all of our numbers are starting to trend in a more positive direction, 25 days of the cases going down, hospitalizations, as low as they've been since November. Are we considering easing any of the restrictions that still exist, like, the restaurant capacity limitations and public gathering limits? Are those things that still need to stay in place, or are we thinking about tweaking them as the numbers are getting better? Thank you.
Well, Charles, I'll surely always welcome advice from all the experts that are around me and everything. But right now, Charles, I've not heard one peep from anybody in regard to looking at relaxing things. I don't want people to drop their guard. We got to get a little bit more time under our belt. But Clay, if you want to jump in here on that, maybe you could add a little bit.
Thank you, Governor, and thank you, Charles. I think that the governor is spot on as usual. We know that the variant viruses are in the U.S. and two border states, Virginia and Maryland, have had detection of the South African variant, and the United Kingdom variant is becoming more commonplace in our country. So as we go forward, we know that it is so powerful, as retired General Hoyer pointed out in his comments, that we immunize as many people as possible, because we know it really does two things. Number one, it prevents them from having severe complications of COVID-19 and from getting infected as they get their entire series, but also keeps the virus from replicating. So it's really important, as the governor said right now, to be very, very strong with wearing our mask and being very careful, because as we're seeing good news, which is fantastic, we know that there is a turbulent storm that could be coming toward us, and it is really to our benefit to do everything we can to stop that from entering West Virginia.
All right, thank you, Charles. Next to Larissa Casillas with Nexstar Media.
Hi, I got my flu shot at a CVS this year. It was really convenient. So I'm wondering, just to clarify, and sorry if this is repetitive, but who would be considered essential as we go forth with the Walgreens rollout next week?
If I understand the question, I don't know why I'm having trouble hearing today, but you can go to the website, you look up all the essential stuff on the website. Does anybody else have anything to add there? General, if you got...
I might add just one thing, Governor. It's really important, as we've talked about, that the essential workers that we're focused on are really the over 50-year-old workers, because we know that incorporates, as was pointed out, 97% of the ages of deaths from COVID-19. We will get to people that are younger over time, but we really are focused on that group of people, and the save our wisdom, our elderly, which have the highest risk of dying and being hospitalized.
All right, thank you, Larissa. Next to Joe Severino with the Charleston Gazette-Mail.
Hi, everybody. I just kind of wanted to follow back up on what I asked Monday, maybe just kind of in a different way. Kind of like a two-part question. First, for kind of the health experts, some of the stuff we've written about, some of these minority health clinics across the state. People, will say racist things about it. Why are they getting one? Things like that. So I kind of just wanted to ask the health experts, the reason that we are doing this, the reason that, we have these clinics in minority communities. And then for Governor Justice, I kind of just want you to speak on the importance of having these in our wisdom operation that you have. In West Virginia, there's probably about less than 1,800 Black people who are over 80. So when we're talking about saving our wisdom, it's much more important in this community because they're so less in numbers. So can I kind of just have you speak on that, Governor Justice, after the health officials? Thank you.
Well, let me jump in front here and just say just this, because I want everybody to understand this and understand this loud and clear. We do know, do we not? And again, I'm going to be the guy that just always speaks the truth, and that's all there is to it. We do know that disproportionately this killer had surely some significant adverse disproportionate effects, on our African American community. We know it. And so from the standpoint of someone saying, well, why are you doing this, in the African American community and throwing off on that? That's not fair. That's just not right. I mean, that's all there is to it, because we are trying with all in us to do all we possibly can to serve all. First and foremost, to God above, all of us are one and the same. And and if we can help a community, that is really struggling a little bit more by statistics and everything that we've already got, well, that's what we do. I mean, for crying out loud, that's exactly what we do. Now, y'all, maybe the health, officials jump in, please.
I think you said it very well, Governor. We are working with our African American task force and community leaders to make sure that we provide access and we provide and support the professionals that work in these communities to be trusted by community members, so that when community members in these communities of color that have a higher, as you say, statistical likelihood of having more severe consequences of COVID-19 and higher likelihood of being tested less frequently, that we build the trust so that we can approach and address those health problems of the African American community and other communities of color, just like we want to provide that care for everyone in our state.
And come back to me just one second. Joe, I think it's a great question. I think, the awareness, for everybody is absolutely great. But at the end of the day, I mean, let's just tell it like it is. I believe that West Virginians have been beat down in a lot of ways over the decades and decades and decades. And, and expected in a lot of ways, to just accept being dead last and everything. Well, in all honesty, just to be perfectly honest, in African American communities, maybe across this land and everything, maybe they, and there isn't even maybe to it. They were neglected in a lot of different ways. We're not going to have that happen in West Virginia. If we can help it, we're just not going to have that happen. That's just all there is to it.
All right, thank you, Joe. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Legislature is back. Legislators are, by definition, political animals, and that means that there could be a lot more political statements and posturing being done over the next 60 days or so. Is there a way to mitigate that? Have you reached out to the minority party and maybe even opened more doors than were open before in order to keep that at a low boil rather than boiling over?
Well, Paul, all of us are reaching out to the minority party, to the majority party, and we're trying with all in us to just do one thing. You'll hear me in the State of the State tonight just say exactly this, and this is all there is to it. I know that it is deeply important for a lot of people in that legislature and all across our state maybe. It's deeply important to us to be Republicans and to be Democrats, but at the end of the day, at the end of the day, what real obligation do we have? We have an obligation to be great West Virginians, and we have an obligation to be great Americans. We have an obligation to be great human beings, and for crying out loud, can we all not just see, absolutely right in front of us what goes on in Washington, D.C. every day, and we don't need it in West Virginia. We just don't need it. You're right. Today you very well could have people posturing and doing this and that, but I hope to God above we can grow out of some of this pettiness and everything that leads us to nowhere. This state's really doing good. We don't need to absolutely just step back and blow our feet off.
All right, thank you, Paul. Governor, back to you.
Well, I didn't expect that quick, but I know we got to go quick today and everything, and I know that we've got some weather coming, but we deal with weather. I would caution everybody to be safe and all they're doing. The only other comment that I'd have is Pfizer continues to come out with great news on their ability to produce more, and that's really going our way. I really believe this. I believe in very short order, whether it be Johnson & Johnson or Pfizer or whomever it may be, I believe that this deal about vaccines, you got to get vaccines and all that kind of stuff is going to greatly diminish, because we are going to have the vaccines, and those who know how to administer it, and to God above, we got this. We got this down pat. You've just listened, to a great general, and there's no way I'm going to call him retired, because if this is retired, I don't know what he's doing. But nevertheless, you listen to a great general and great medical experts and everything, and they are absolutely on it, and I'm going to continue to push, and we're going to get these shots in people's arms just when we get them. So just hang in there, West Virginia. Keep everybody pulling the rope together, and please remember the 2,175 people that we've lost in your prayers, your thoughts. It's a crying shame and everything, but we want these people to know that they're not alone. God bless all of you. Thank you.